In today's health headlines, are cancer rates rising in people under the age of 50? What is being done about cancer in the younger population? And an update on big breakthroughs in cancer therapy. Joining me is Dr. Eric Weiner, Director of Yale Cancer Center and President and Physician-in-Chief at Smilow Cancer Hospital. Welcome to you, Doctor.
Thanks. It's good to be here.
Good. All right. Recent data has found that cancer rates are rising in those under the age of 50. What do we know about this?
So it's particularly in individuals with colon cancer, where we're seeing more colon cancer in younger individuals. And the reasons for it are really unclear, but many people think that it may have to do with changes in diet as well as increasing rates of obesity. Really more research needs to be done, but it's a big problem, and it actually prompted changes in the screening guidelines for colon cancer so that the age went down from 50 to 45.
Should it be even lower than that, do you think?
I think at the moment, probably not, but I think that could come. I think there's a general sense that people have that there's more cancer across the board in younger individuals. I'm not sure that's totally true. In breast cancer, for example, there's often talk about breast cancer in young women, but there has long been breast cancer in young women, and the rates haven't increased substantially over time, although I think we are much more aware of it than we used to be, and it clearly is a problem.
I see. All right. What efforts are being made to manage this increase in cancer diagnoses in younger adults?
Well, so I think there are a couple of issues for younger people, or more than a couple. First, younger people tend to be diagnosed at a later stage because both they and their doctors are not thinking about cancer oftentimes. Beyond that, the cancers tend to have a somewhat more biologically aggressive appearance under the microscope and act in a more aggressive way. And that may partially be related to the fact that some people who are younger have an inherited predisposition to cancer. So we clearly need to do better about detecting cancers, and we need to do better about treating cancers in these younger individuals. And then finally, let me just say, in younger people, cancer is a real shock. And you're 40 years old and you have 2 young children, or you're 40 years old and you're thinking about having a child for the first time. And it's not just about you, it's about you and your family. And the psychosocial implications of that, the effects on your mental health, the effects on your family's mental health are huge. So I just want to say one of the things we're doing here at Yale is developing a program across all of our sites in the state focused on younger individuals with cancer, so people under the age of 50, to try to make sure they get the best treatment and also attend to everything else.
And finally, in the time we have left, breakthroughs?
So the breakthroughs in cancer medicine mostly fall into 2 areas. One, huge breakthroughs in immunotherapy. And immunotherapy, which really came on the scene about a decade ago, has had a huge impact across many, many cancers. Not all, but many. And then the other big breakthrough are these so-called targeted therapies that go after a molecular change in a cancer cell. So rather than in everyone just using chemotherapy that is like using an atomic bomb on a cancer, doing something a little bit more specific. Doesn't mean that chemotherapy has gone away, and we still need it much of the time, but we're getting better and smarter.
Dr. Weiner, always a pleasure. Thank you so much for your insight today, and have a great weekend.